Hi there.
Hi.
My name is Jessica. I'm going to be your nurse today, assessing you.
Perfect.
How are you feeling?
Good.
Good. Can you give me your name and date of birth?
Christopher Simmons, August 2nd, 1987.
Thank you. All right, so today we're going to be assessing your chest, lungs, heart. So first, I just want to kind of observe you, just breathe regularly. It looks like you're not struggling in any way to breathe. Your chest expansion is symmetrical. If you could just look up a little bit for me. Trachea is midline, appropriate size. Substernal notch is present. And I'm just going to assess your respiratory rate and rhythm. So just breathe normally. So respiratory rate is 16 with a regular rhythm. Chest movement and, like I said, symmetry is perfect within normal limits, and there's no use of accessory muscles during breathing. So I am going to go ahead and take a listen. I'm going to go to your back. You could take a deep breath for me. Good. One more over here. All right. Breath sounds are clear bilaterally in all lobes. I'm going to go ahead and listen to the front. I know it's a lot of deep breathing. Good. I'm going to go under here. And one more. Awesome. So you're also clear bilaterally from the front. I don't hear any crackles, rails, wheezes, bronchi, stridor, or any type of pleural friction rub. Your thoracic expansion is symmetrical on both sides. So I'm just going to take a feel. So there is no crepitus present. I'm going to come back here and I want you to lean forward, sit up straight, and say 99.
99.
Good. Again.
99.
Good. Again.
99.
Good. Perfect. All right. So I'm just going to go ahead and do some percussion. If you could sit up straight for me. Okay, so in percussion, it is dull. Okay. So measurement of diaphragmatic excursion. All right. So I want you to, because the back of the chair is kind of high, so maybe scoot to the and then sit up nice and tall for me. And I am going to do some percussion down your back. So at first, I want you to exhale all of your air and then hold that for me. Okay? Okay. And then I want you to take a deep breath in and hold. All right. So that is about 2 inches, which is about 4.5 to 5 centimeters of diaphragmatic excursion. And for a young, healthy male, that is normal.
Perfect.
All right. And then, so I don't have any unexpected breath sounds as we covered earlier. We discussed or went through 1 through 7 on your back, 1 through 5 on the front, and there were no unexpected breath sounds. Vocal resonance. I'm going to go ahead and take a listen while you say 99.
99. 99. 99. 99.
Good. So there is no consolidation present. And then that concludes our chest and lung part of our physical assessment. Okay, for the next part of our exam, we're going to discuss your breast exam and your axillary exam, which we have already done privately off screen. Okay, so when it comes to the inspection and palpation of your chest, the size, contour, and symmetry of both chest, breast area is symmetric. The skin color is the same on both sides. Texture, there is no dimpling, retractions. There are no abnormal venous patterns, lesions, sores, and your nipples are presenting normal. So we went over palpation of your chest with your arms in the air, lying, and no nodules were felt. Your axillary lymph nodes were completely normal. Your palpation of the breast tissue was normal within limits. And there are no issues with the areola on inspection and palpation. And that is it for our breast inspection. So we will be moving forward with your heart inspection. All right, Christopher, we are going to go ahead and move forward with your heart assessment. Okay, so I'm going to go ahead and use tangential lighting and inspect your jugular veins, make sure there's no distension or prominent pulsations. So I'm just going to inspect you from the side. If you could go ahead and look to the side for me. Good. I don't see any jugular vein distension or intense pulsations. Okay. So we have your sternum, which is in a normal position. Okay. I would like you to go ahead and lay on your back and have your feet out this way. Good. And what we are looking for here is heaves. So I'm going to go ahead and use the ulnar side of my hand, and I'm going to feel here. Okay. And at the apex. Okay. And at the mitral valve. Good. There are no heaves present. And then I'm going to palpate with the palm of my hand for any thrills. So we are going the aortic valve, pulmonic valve, Erb's point, tricuspid, and the mitral valve. And there are no thrills present. Good. And then I am going to go ahead and have you sit up. We're going to auscultate some heart sounds. We're going to listen to the aortic valve. Pulmonic valve. Erb's point. Tricuspid. And the mitral valve. Good. And then we will go with the bell side and listen for murmurs at the same points at the aortic valve, pulmonic, Erb's point, tricuspid, and the mitral valve. Good. There are no murmurs present. S1 and S2 heart sounds are present with no S3 or S4 sounds present. Okay. Okay. Lastly, with our inspection, I want you to lay on your left side, and I'm going to go ahead and listen to your heart sounds one more time. Aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And that is all within normal range. You can go ahead and sit up for me. And that concludes our assessment today. So thank you, Christopher Simmons. It was a pleasure.
Always.